This is Marva Silva. She's a client of mine. She came to the Hesch Institute in Henderson, Nevada, close to Las Vegas. And I asked her if we could do a brief interview after seeing her for 3 days for her chronic pain syndrome. And so here's Marva.
Hi, my name is Marva Silva. I came out to the Hesch Institute this past Wednesday. Today's Friday. And I came to see Jerry because I'm having severe chronic pain, trouble walking, sitting, standing, and I've seen several specialists. Haven't gotten any kind of clue as to what's happening or what I can do to remedy it. As I said, I saw Jerry for the first time on Wednesday, and I have to say that for me this has been a very positive experience. His treatment allowed me just on the first day to feel a little bit more relief when I was walking. I was able to walk a lot longer than I have in several months. He did quite a few other things. I spent 2 hours with him each day, Wednesday, Thursday, Friday, and I think overall what I can say about this whole experience was that I'm very happy that I came. I feel now that I know what's happening to my body. I have a plan now as to how to, get back to health and strength. Whereas when I got here, I had no idea what was happening. I had no idea what I would do. And I'm gonna leave here today feeling very optimistic about my future, very optimistic about my pain management, and just feeling overall very happy that I came.
And I'll ask your husband Ruben to comment. Thanks
Okay.
very much. I appreciate it. Ruben, you want to just give us a general comment about your experience there?
My wife was really nervous coming here. After our first visit on Wednesday, with just, I think the first session of about 10 minutes, she got up and was able to stand on her right foot, on her right leg by herself, and she hasn't been able to do that for about 5 months. We've been walking around. She has a lot more strength in her legs. She's not 100%. I don't think she's 60%, but we walked in here and she was about 10%, and I think she's about 30-40% right now. And she is really pinpointing the pains and where it's coming from, and I think we've determined it was a down slip, and she's tried some support belts that are absolutely taking everything away. And
So you're talking about the vertical SI belt.
Vertical SI
Yeah,
belt.
not many people know about a vertical SI support. I've developed it years ago because there are some people that have a vertical instability. So wearing a belt around the pelvis won't help that. You need the
Right.
up and down support.
Yeah, I think it's just like wearing those belts to work for guys. I mean, after a while, it's just very discomforting, and it doesn't do anything when you're walking. It's just for lifting, so it's not doing anything. And, it was just creating pressure here. But the vertical support, the belt, I mean, that just does the lift where the downward slip is, and that was immediate relief there.
So can you just describe, I don't have one right in front of me, can you describe how it's worn, how the vertical support is?
It's kind of like a harness, like a rigging harness, or like those harnesses that you put on when you're doing the bungee jumping
Yep.
or something. But it's just a one belt, so you kind of like straddle it, kind of like lifting a butt cheek.
Yep.
Goes over your shoulder. You can
That's it.
adjust the tension. So
Very good.
It's doing the whole pull up here.
Yep.
She put it on and felt the immediate pressure disappear on this side of her body here.
That was interesting. That was very
Yeah.
interesting for her to feel the relief on the left side of her shoulder
Yeah,
by wearing that
instantly.
support.
I mean, just-
So I agree with her and with her perception that the pelvis is the core issue for her. And from that, there's the other satellite things that happen. One thing I wanted to ask you about is that, do you recall that I pointed at that x-ray?
Yeah.
Can you describe that? Has anyone else pointed that part of that x-ray?
The x-ray that wasn't clear?
The pubic joint.
Oh, right, that the pubic joint was like too big,
Too wide, too wide.
really wide.
Yeah, yeah.
Yeah.
It was they actually didn't cover the whole pubic joint, but it covered at least the upper half of
Right,
it.
right.
And we measured it. We took pictures of it, and that was 10 millimeters wide.
Mm-hmm.
Normal width at the middle of the joint is 2 to 4 millimeters. So I think right there we had some objective evidence that we were dealing with a hypermobile pelvic joint issue.
Right, right. Yeah. That's the other thing is that we've seen quite a few specialists in the 7 months that she's been dealing with this, and you rarely get these people that whether they're orthopedic doctors, excuse me,
Neurosurgeons.
neurosurgeons, even family doctors don't really touch you anymore just to detect where your pain's coming from. They just really want to do the blood test and just do x-rays, and then you go to the next guy and it's the same thing all over again, and he doesn't read that guy's x-rays or his MRIs, and then you get denials and stuff. So when you see somebody that really is a specialist in the general area that can actually lay hands on you and say, hey, this isn't mobile, and this is, there's something going on here, and then the upper part of your back and your ribs is affected with this whole side. People don't do that.
Right.
I think that's a big difference is, if you say your hand hurts and the doctor never touched your hand to detect whether it's your wrist or your finger, and he just gives you Motrin and just sends you off an x-ray, what if it's a muscle damage? What if you tore something? People need to be touched. People don't touch people anymore.
Right, right.
You need to feel some things.
Yeah, for movement problems like her joint that moves too much, the only way I could discern that was to touch the ligaments, impart passive force through that joint, and find that in a couple of directions it didn't move, and in the downward direction it moved too much.
Right.
So yeah, I agree with you. I think that there's a very valuable aspect to hands-on care, and of course the flip of that is you need to know when it doesn't belong in that domain.
Right.
But unfortunately that is an area where there isn't enough that's understood or enough practiced. And I'm glad that she was able to come here, and I was concerned in communicating with her before she came out. I just didn't know if I would be able to help her, so I'm very happy that in fact I was, and I feel very confident that her future is very bright.
Yeah, I mean, every time we've seen somebody, we're very, very hopeful, and we're just like, we're at the right place, and then you leave, and most of the times you leave knowing that you didn't go to the right place. But she definitely feels that we're at the right place. Yeah, I mean, just she walked in with just drained, and you see like a sense of life in her again.
Yeah, yeah,
So
I saw
think
that.
that's all that matters. So I think we're in the right place.
So you're talking about this smiling face there.
Yeah.
His face, yeah. Thank
Very
you, Jerry.
good. Yep, very good. Well, thanks so much. I really appreciate it.
All right.
Okay.